Hi guys, I'm Li Wing. For the first August presentation, I'm going to talk about congestive heart failure. So ID, YT, day of birth, January 17, 1959, a Hispanic male came to the clinic for complaint of shortness of breath and increased fatigue for about 2 months. He's a reliable individual, can provide his medical history as well as permission for the healthcare provider for the physical examination. His chief complaint is, I can catch my breath and feel more tired. I cannot exercise for about 2 months now. History of recent illness. YT is a 65-year-old Hispanic male who comes to the office for complaining of fatigue, dyspnea, and intolerance to exercise. The patient reported the symptoms started about 2 months ago, and the symptoms has been worsening over time. He reports to get relief from the symptom. He stopped what he's doing and rest for about a few minutes. And he denied taking any medication or supplement for the symptoms. He also mentioned that he started noting swelling on both of his legs for about 2 months ago, and the swelling has been worsening over time. He has not done anything to alleviate the symptom of the legs, and he endorsed hypertension that diagnosed when he was 35-year-old and has been taking medication for the condition. He admits past smoking history started when he was 20 years of age, and for about 22 years he quit smoking for about 12 years ago. He also reports occasional coughing due to seasonal allergy that he has been having for decades. He denies palpitation, skip heartbeat, chest pain, no fever, chill, malaise, weight loss or weight gain. Past medical history, hypertension, taking amlodipine 10 mg once daily, appendectomy in 2018. His last physical is August 2023. He's updated with COVID vaccine and flu vaccine, Shingrix and pneumococcal vaccine. He has no allergy to medication, food. Family history, his father, he's 82 and has hypertension and hyperlipidemia. His mom 75 and healthy. He has 2 sons, 28 and 24, they are healthy. Social history, besides smoking history, he drinks 5 to 6 beers socially in a week. He denies using any other drugs. He used to go to the gym to walk on a treadmill for about 45 to 1 hour, 4 to 5 times a week. Now he stopped due to the symptoms. He, regarding diet, he said he doesn't commit to the hypertension diet. He likes eating fast food because of this busy schedule as an electrician. He doesn't like to eat vegetable or fruit, but he likes to eat red meat a lot. He has no sleeping issue and sleeps 7 to 8 hours at night. Review system, beside the respiratory, cardiovascular, and musculoskeletal symptoms. He denied bruising, easy bleeding, denies swollen glands, heat and cold intolerance, denies increased or decreased thirst or hunger. General survey, he was sitting comfortably in the exam room with tidy outfit, mild distress because of the overall fatigue. He appeared as a healthy person, good posture, no abnormal odor, no difficulty with mobility. Vital sign, his pulse is 89, blood pressure 138/77, temperature 97.5, respiratory rate is 22, O2 size is 29 on room air. His weight is 197 pounds. His height is 5 feet 7, BMI is 30.9. With the electrocardiogram, show normal sinus rhythm with low QRS voltage, left atrial enlargement and non-specific ST segment and T-wave changes. Respiratory exam is unremarkable. Cardiovascular show increased jugular venous pressure 4 centimeters above the sternal angle. And also upon auscultation of the heart sound, we detect the H3 or the low pitch dorsal auscultated at the apex of the heart, and his popliteal patellis, pedis, and posterior tibial pulse are the 1+. capillary of bilateral toes is about 4 seconds, and he also has 1+ edema bilateral lower extremity. So the first diagnosis is acute systolic heart failure according to the clinical practice guideline by the European Cardiovascular Society. YT demonstrate clinical manifestation of CHF, including increased shortness of breath, fatigue, edema, lower extremity, and physical examination also review increased jugular venous pressure, auscultated H3, and 1+ edema, pitting edema, which meet the criteria diagnosis of CHF. The second diagnosis is COPD because of his smoking history, occasional coughing. So according to the Gold Committee clinical guideline, YT may experience COPD. However, we need to do extra diagnostic testing to rule out the condition. And my third diagnosis is physical inactivity. YT has the elevated BMI of 30.9, and he didn't commit to the hypertension diet, and he has the sedentary lifestyle with he didn't exercise enough. So this is the appropriate diagnosis for him. My final diagnosis is acute systolic congestive heart failure. YT report dyspnea with exertion, edema, and fatigue, which are the clinical presentation of CHF, and also physical assessment review neck vein distension suggesting CHF. So this will be my final diagnosis. So diagnostic plan, I will do the B-type natriuretic peptide level to detect if it's abnormal or raised BNP may indicate structural or functional cardiac abnormality. I will do the X-ray to rule out any lungs condition, and I will also suggest the echocardiography, and it should be done by the refer of the cardiologist. So pharmacological, I will do furosemide 10 mg once daily for about a week, as per suggestion from the clinical practice guideline of the European Cardiovascular Society. And I will advise him to increase physical activity and adhere to the low salt or Mediterranean diet, which is the optimal diet for heart disease and for overweight people. I will refer him to the cardiologist. And for education, I will ask him to monitor his weight every day and report weight gain over than 3 pounds, side effect of furosemide including dizziness and worsening of CHF that need to go to urgent care immediately. I will follow up with him in about 1 week of the completion of medication for evaluation. Thank you so much for listening.